Hello, and welcome to Chagpar MD. I'm Dr. Anise Chagpar, and I have a very special guest with me today. Dr. Ben Judson is a professor of surgery and the chief of otolaryngology here at Yale Cancer Center and Yale University School of Medicine. We're going to talk today about throat cancer and particularly about HPV-associated cancers. Now, many of you may have heard about HPV and have questions about that. Many of you may have associated it with cervical cancer, and you may be thinking, wait a minute, I thought that he's looking at things above the cervix. Well, he is, but we're going to get into all of that right now. So what do you say? Let's get started. Hi, Ben. Thanks so much for joining me today.
Anise, thank you very much for having me as a guest.
So, Ben, I thought we would talk a little bit about throat cancers. I know that you do head and neck cancers, but kind of put everything into context for us. How common are these? Who do they affect? And how deadly are they?
Yeah, those are all good questions. In some ways, I think of these as they're not common cancers, but they're not rare cancers. In terms of like how frequent they are, they're in the same neighborhood as, let's say, thyroid cancers or melanoma. Maybe those cancers are a little bit better known amongst the public, but this is sort of in the same neighborhood or in terms of how frequently it happens. But I think that there's less of a level of awareness. People don't really know about this as much as maybe some others.
I was about to say, everybody's heard about melanoma, everybody's heard about thyroid cancer, but I think that we really don't hear about throat cancer. I think the last time we really heard about throat cancer was when Michael Douglas developed throat cancer. But that's been a while now. So it actually seems to be pretty common. So are these deadly cancers or are these well treated? Tell us a little bit more about the epidemiology.
Got it. So it's interesting, historically, throat cancers were mostly associated with the risk factors of smoking and drinking. And there really is like this dose response. Like the more someone has smoked cigarettes or chewed tobacco and drunk alcohol over their lifetime, the greater risk they are at developing a throat cancer. What's new are these HPV-associated cancers. And these, as the smoking rates in our country have come down, we're seeing less and less of the smoking-related cancers. But unfortunately, we're seeing a quite dramatic rise in the HPV-associated throat cancers. So these are much, increasingly common.
So let me just stop you there for 1 second, just to ask you 2 questions. One question that a lot of people always ask me is, okay, the risk increases with my exposure to smoking and alcohol. And, I can't go back to the past. All I can do now is quit. Is there a point at which you can say, you know what, if you quit now, you reduce your risk? Or is the damage already done, like, it's a fait accompli, so you may as well keep going?
I think it always makes sense to quit. Even patients, sometimes you have patients who, have been a lifelong smoker and they'll develop a cancer and they'll say, well, I've smoked my whole life, I'm just going to keep going. But actually, by stopping smoking, you reduce the risk of, you dramatically increase your opportunity to be cured from that cancer, and you reduce the risk of developing another cancer. So the benefit is big. For even someone who smoked for decades and decades and decades, if they're able to stop, the benefit to them is big. So it still makes sense to try to do that. Not always easy, but important to have that goal.
I was about to say, it is not easy. So the second part of that question is, how do people quit? Are there resources that are available? Like, if people have been lifelong smokers and they're watching this show and they're thinking, okay, Ben, I get it. I should quit smoking. It's good for reducing my risk of cancer. It's good for reducing my risk of heart attack. It's good for reducing my risk of poor dentition and so many other things. But it's really hard to quit. So what advice do you have for people in terms of where they can get help to quit? Because for a lot of people, it may be like, you know what, it's just too dang difficult. I'm just going to keep going.
Yeah. You know, it is, as you say, it can be incredibly difficult, but it's still, I guess I emphasize to people that it's a good goal. And then I think the key is to get professional help. And, 15, 20 years ago, I used to help people myself in terms of prescribing things, but the science has changed, the different treatments, and you can't even keep up with it. But there are people who do. So I feel like the key thing is, once you say, okay, I'm going to try to stop smoking, is to see someone who is up to date with all the different, potential treatments, and get them to help you to do it.
Yep. So whether that's your family doctor or a cancer center, many states have a quit line. There are some great resources on the CDC website to help you to quit. There's even an app. And we'll leave you those resources in the description box below, because I don't want to give you guys any excuses for not quitting smoking. But this brings me to the next point. So Ben, you had mentioned that, we've seen that the incidence of smoking-related throat cancers has come down, but the incidence of HPV-related cancers has gone up. Now, how can you tell the difference between a smoking-related cancer and an HPV-related cancer? Is that just by history based on what risk factors people have? Or is there fundamentally a difference in tumor biology, how these cancers look under the microscope, what they look like pathologically?
I think the answer is yes and yes. Really the way to know for sure is to look under the microscope at them. And there's some tests that can be done on the cancer so that we know that this is a HPV-associated cancer or not. So we can sort of know for sure by asking our pathology colleagues to do those tests. But we also know by who's affected. The people who develop smoking-related cancers have smoked, and usually they're older, because it's a cumulative risk over time. And increasingly, we're seeing these HPV-positive cancers in patients that would never, many of them have never smoked ever, and they tend to be younger. And so, and they also present with a particular pattern in terms of how they show up and how they affect people. So we can sort of know, we can know for sure by testing, but when someone comes in the door, oftentimes just by talking to them and examining them and figuring out what's going on, we have a pretty good sense right then and there about whether it's a smoking, drinking related cancer or an HPV related cancer.
So tell me more about how they present. Like, what are these key symptoms that make you think this is somebody who's got an HPV-related cancer versus not?
Well, they present in a tricky way. So these are cancers that start in the throat, and frequently they'll spread to lymph nodes in the neck. And the area where it starts in the throat frequently is small, and so it oftentimes remains asymptomatic. So someone will have a small growth in their throat. They may have some very vague symptoms, and then in about 80% of the time, the first thing that someone notices is actually a physical lump in the neck. These cancers affect men more frequently than women. About 70 to 80% of the time it affects men. And so one of the most common things is someone will say, well, I was shaving and I noticed a lump, or someone that they, live with or in their family or work with says, I think I see something, and otherwise they feel fine. And that is actually one of the tricky things, is that there's, occasionally we'll see someone that doesn't then seek care, and it can sort of delay the diagnosis and the treatment a little bit.
Yeah, I think that that's a common misperception that a lot of people have, is that cancer is always painful. And if you feel a lump or you're feeling otherwise fine, it couldn't possibly be cancer. But we know for breast cancer, for example, and it seems that for throat cancer as well, sometimes the first signs and symptoms are just a painless lump. And so if you feel something that's new, even if it's painless, you should get it checked out.
Yes.
So you mentioned that many of these are small, but by the time people actually notice a lump in the neck, one would think that would be a bit larger. So are there any screening tests that people should get? Like, for breast cancer, it's pretty easy. We have talked about mammograms, and for any of you who have missed that video, it's going to be linked here as well. But what about for throat cancer? I mean, we don't really talk about or know about too many screening tests for throat cancer. What should people be doing, if anything?
Yeah, it's a great question. So, I guess the bottom line is that there's not really there's no screening tests that are known for this cancer. There is a great prevention, which is the vaccine. There's an HPV vaccine that's available, but that's only going to help the next generation, people who are maybe in their teens and their 20s now. And there's been a lot of work trying to find a screening tool, like colonoscopy for colon cancer, or, screening for prostate cancer, or you mentioned breast cancer, but there's nothing like that for throat cancer.
Yeah, I suppose that, the other thing is just being really vigilant about your own self-awareness and self-care, so that when you are shaving, you kind of go, there's a lump there that wasn't there last month, or, going to see your dentist who might be able to find lumps in your mouth or neck or throat as well. So let's talk about this HPV vaccine, because, when people think about HPV, a lot of people think about cervical cancer and they think about sexually transmitted diseases. When they think about throat cancer, they don't think about either of those two things. So put it together for us. How exactly does this work?
Well, it's, we're still learning more about how it works. But some of the things that we do know are that most Americans are exposed to this virus. Probably 80 to 90% of us are exposed to the virus at some point in our life. And usually when we're exposed to that virus, our immune system clears it and it's gone and that's it. For some individuals, the virus seems to be able to evade our immune system, and it hides out in our tonsils or on the back of our tongue, like far back. And if it sits there for decades, that's sort of a risk factor for developing a cancer later on. And so, when we see someone today who shows up with an HPV-related cancer, the thought is they were probably exposed to the virus, 30 years ago or something. And for some reason, it's been small, it's just hidden out in that spot. And now all these decades later, it's causing a cancer. As you said, that we usually think about HPV viruses causing genital warts or causing cervical cancer in women, and that was really the driver for developing a vaccine against the virus. But it's the same strain of virus that causes those problems also is the one that causes throat cancer. So the same vaccine that will prevent the genital warts and cervical cancer will also prevent this kind of throat cancer.
And I think that this brings us to the next point, which is, you mentioned that these HPV-related throat cancers are more frequent actually in men than in women. And so whereas people often think about cervical cancer vaccines for women, it really behooves both genders to be getting the HPV vaccine.
I think that's right. I mean, although the HPV virus causes throat cancer more frequently in men, it does cause throat cancers in women. And 10 years ago plus, when the vaccine was first coming out in the U.S., the thought was it would mostly be useful in preventing cervical cancer. But now, overall, HPV causes more throat cancers than it causes cervical cancers overall. And so probably the biggest benefit of the vaccine is going to be to prevent throat cancers in the future.
Wow, I did not know that. So that's really cool. Can you tell us a little bit more about what the current guidelines for vaccination are?
Yep, they've changed. I mean, so the guidelines or the recommendations from the CDC are for both males and females to be vaccinated. And, everyone in the younger age to get vaccinated, their recommendation is to start the vaccination at age 12. But they've recently extended the age limit, the upper age limit for consideration of getting vaccinated up into the 40s. And the thought is that, even though the thought is that most of us are probably exposed to this virus earlier in life, if you haven't been exposed, the vaccine would potentially prevent infection and later on prevent the risk of having one of these cancers.
And so, and it's not just one dose of the vaccine, right? You need at least a couple, is that right?
It's 2 doses, yeah. So in the United States, about only 50% of young Americans who are eligible for the vaccine have received both doses of the vaccine. Only about 50%. About another 10% have received 1 dose, but not the second dose.
So why is that, Ben? I mean, what are really the concerns of people in terms of vaccination? Because by far, when you talk to people about cancer, one of the first questions that you get asked is, why can't you brilliant scientists figure out a way to prevent cancer? And here you have a vaccine that can prevent both cervical cancer and throat cancers, and yet people aren't taking it. So what
Yeah.
concern?
Well, I think it's a complex issue, Anise, but I think, as you well know, but I think, there are general concerns people have about the safety of vaccinations, which I think are largely unfounded. Vaccinations are very safe, and this one in particular has been given to hundreds of millions of people around the world at this point, and we really know this is a very safe vaccination. I think the other piece is that there's not people have been thinking about this vaccine as something to prevent genital warts or something, and they don't really realize that this is a potentially life-saving cancer-preventing vaccine. And so I think that's a message that is important to try to get out there more. Just like in our doctors, in any physician's office, we ask, like, do you smoke or not? Because if we're able to encourage someone to not smoking, that is a great benefit. Just as importantly, I think we should be asking people, are you vaccinated against HPV? Because that also is a relatively easy way to prevent the risk of having one of these cancers.
But if they are over the age of 45 or 46 or whatever that upper limit is, and they say, no, actually, I haven't been vaccinated, can we still offer a vaccine? Would it be helpful at that point, or is the horse kind of out of the barn?
There's no recommendation to be vaccinated over the age of 45. And I think that we just don't know what the benefit is at that point.
So how many of these throat cancers, proportionately, are HPV related? So I know that some of them are caused by smoking, and we've seen that proportion go down, and we've seen the HPV related cancers go up. But when you take all throat cancers that you see today, what proportion are caused by HPV, do you think?
It's about 70 to 80% of throat cancers in the United States are now caused by HPV. So the smoking related cancers have come down, and the HPV associated cancers have gone up.
But that's a lot of throat cancers being caused by HPV. So then my next question is, how effective is the vaccine? I mean, so you take the vaccine, is that 100% guarantee that you're not going to get an HPV related cancer, or is it only marginally effective?
It's as close to 100% as we can get, I think. The vaccination is very effective at preventing the virus infection, and as long as that's avoided, your risk it really eliminates that risk. So it's a highly effective vaccine.
And are there any side effects associated with the vaccine? I know that, some people have concerns about autism, which largely I think have been unfounded, but any other side effects that people should know about with the vaccine that might prevent them from getting it?
This has really been an incredibly safe vaccination. You can get a sore shoulder, afterwards, things, mild side effects like that. But there's no evidence of longer term issues from the vaccine other than it preventing cancer.
And so for people who are watching this, who want to get the vaccine, now that you have thoroughly convinced them that they should do that for their kids or for themselves if they're under the age of 45, where do they get the vaccine? And is it covered by insurance? And if they don't have insurance, is it covered by, other, general free health programs?
Generally covered by insurance, under the age of 20s. Above that, it varies insurance by insurance, but there are programs through the manufacturers of the vaccination to make it available at a very much reduced cost for others. And if you look on the online, there's some resources about that.
So if you provide me those resources, we'll link that in the description box below as well, because again, we don't want to give you any excuses not to get vaccinated if that really is something that has been borne out in terms of evidence to reduce your risk of cancer. The other question that I have is in terms of, you know, you mentioned that people are exposed to HPV at an early age, and it kind of hangs out in the tonsil or at the back of the tongue. So if people have had their tonsils out, does that reduce their risk?
It's an interesting question. It does seem to reduce the risk slightly of developing tonsil cancer. But you can still have the virus can still hide out in the back of the tongue. So it hasn't really changed recommendations about tonsillectomy itself.
All right. So I guess the moral of the story is get vaccinated and get vaccinated early, because as you mentioned, most of these HPV cancers occur at a younger age. So how old is the average for HPV-related throat cancers?
The average is actually in the 40s, and I've seen people in the 30s and even the 20s who have had these cancers. But you oftentimes, most frequently, is people who are in their 40s and their 50s develop these cancers. And it's so tough because people are oftentimes they've done everything to take care of themselves. They've never smoked, they exercise, they eat healthy food, whatever it is, and they just don't think of themselves as being, you know, vulnerable to something like this. And in that age, also people are usually sort of right in the midst of, you know, their
Life.
Working and family or whatever it is. They're in the midst of their life, and so it can really be, you know, it can be a little bit of a blindside for folks.
Yeah, nobody expects to get cancer, especially that young. So when you get an HPV-related cancer, especially if you're on the younger side, what is the prognosis? I mean, is this thing like something that is easily treatable and you live the rest of your life and life is grand, or is this something that really is pretty serious and not a whole lot of fun to get?
Well, I guess there are two sides to that. One is that the cure rate for these cancers is very high. It is as high as 90% for most patients. That being said, the treatment is not easy, and the treatment has a lot of side effects. And so oftentimes the specific treatment recommendations are trying to, you know, do everything possible to minimize the side effects of the treatment while still making sure that we maintain that, you know, that excellent cure rate.
So let's talk a little bit about that, because, you know, here on this show, as well as on the radio show Yale Cancer Answers, which Ben is going to be on as well. So be sure to check that out, and we'll leave you a link in the description box below too. We often talk about advances in treatment. So are there advances that have been made in terms of the treatment of throat cancer? I mean, are we getting closer to making this not as bad as it is?
For sure. There are tons of clinical trials every year that are honing our treatments and helping get them a little bit better. You know, the treatments that are the potential ways to treat this cancer include, you know, radiation, chemotherapy, and then also surgery. And so figuring out what combination of those treatments is really one of the keys to, making sure that we reach that goal of sort of minimizing the side effects, but making sure that we're, curing the vast majority of these.
Yeah, I mean, none of those sounds really appealing, though. They all sound like they're just horrific.
They are tough. The throat is a sensitive area, and people absolutely get through these treatments and do fine and get on with their life. But their treatments are tough, and it really disrupts one's life. I mean, it's really a big deal. It's not a little deal. It's a big deal to get through all this stuff.
Now, are there particular therapies that work particularly well for HPV-related cancers? I mean, earlier at the top of the show, we kind of talked about the fact that HPV cancers, you can tell the difference from other smoking-related cancers, for example, under the microscope. So if the biology is fundamentally different, is our treatments fundamentally different as well? I mean, are we getting closer to this personalized medicine kind of goal?
I think we're getting there. One big step is that we're treating these cancers differently than the smoking, drinking related cancers. And these cancers are more vulnerable to all the therapies. They're more vulnerable to radiation and to chemotherapy and to surgery. And so most of the trials that we've been doing over the last several years have been experimenting with trying to reduce the intensity of the treatment and making sure that we're still getting the same cure rates. And so an example of that is we now have the ability to do a sort of a minimally invasive robotic surgery where we operate through the mouth with a robot to remove the throat cancer, and in an open part of the surgery to remove any lymph nodes that are involved. And there's just a large national treatment trial that finished and has been reported out this year, where we enrolled a large number of patients on this trial at Yale, showing that that's a very effective treatment, to use that surgery first and then tailor whether they get no other treatment or they get low dose radiation afterwards, lower than we used to give, or whether they still need sort of standard dose afterwards.
And are HPV-related cancers more susceptible to particular chemotherapeutic agents versus smoking-related cancers, or is there no difference in terms of that?
Still primarily using the same sort of standard of care, or still use the same chemotherapy, but there are trials underway using different types of targeted chemotherapy agents.
And do we know anything about the immune response? I mean, we've talked so much about immunotherapy when we think about other kinds of cancer. And when you think about vaccination, right, you think that your body is mounting an immune response against a particular, in this case, virus. And so when you get an HPV-related cancer, I wonder whether that is in part because your body is not attacking this virus or clearing it as it would normally clear a virus. And so have people looked at immunotherapy in these throat cancers, especially in HPV-related cancers?
Yes, and immunotherapy is now FDA approved for treatment for cancers that have recurred after a prior treatment, and there are trials underway where immunotherapies are being added to sort of standard treatments. One of the things we have to be careful here with is that the standard treatments have an excellent cure rate, right? Like 90% cure rate. And so we have to be very careful. We don't want to, although we're trying to minimize side effects, we do not want to compromise that rate of cure, basically. So we're being, the trials are mostly where an additional therapy is added in some way so that we're not we're getting some benefit, but we're not losing on we're not taking any risks, basically.
Yeah, you don't want to give up what you've got for something that might not be as good. I totally get it. My other question, though, has to do with recurrence, which is, when we think about vaccination, oftentimes vaccines are either giving you a live virus or an attenuated virus, a dead virus, so that your body can mount an immune response and essentially fight off that virus when it shows up again. So if you get an HPV-related cancer, presumably you've had an exposure to that virus, is your risk of recurrence lower? And what does it say to you when somebody recurs with an HPV-related cancer again?
Yeah, this is so fascinating. So one of the things that happens in people who have a smoking, drinking related cancer, those patients are at risk both for cancer recurrence, but they're also at risk for developing a second totally separate smoking related cancer somewhere else over the rest of their lifetime. And that might be as high as a 10% risk of developing a second smoking related cancer. So you mentioned the damage has been done, so now that you smoked and now you could develop the second cancer. That's different with HPV cancers. HPV cancer related throat cancers do have the potential to come back, that patients, we do not see patients developing a separate HPV-related cancer. It just seems to be a one-off. For some, just in my mind, I sort of think about it, the virus hides out in one spot and your body's probably cleared it everywhere else. And if that were to develop into a cancer, hopefully it will cure that cancer, but you're not at any risk of developing a second HPV-related cancer any more than I am, basically, of developing one. It's, so you're not at risk for developing another one, but there is a risk of something coming back, basically. And that's that about, that's that 10 to 15% risk of something coming back.
So if somebody had an HPV-related cervical cancer, and we know that cervical cancer is incredibly common worldwide, for those countries where breast cancer is not the leading malignancy affecting women, cervical cancer is. And many of those are also HPV-related. Now, because the virus strain that causes throat cancer is the same one that causes cervical cancer, are those patients who develop cervical cancer, HPV-related cervical cancer, are they more or less at risk of developing an HPV-related throat cancer, or are those two events completely decoupled and there's no difference?
There seems to be a small link. And so there are large epidemiologic studies looking at individuals who have had an HPV-associated cervical cancer or precancerous lesion, and the risk of themselves or of their spouse developing an HPV-related throat cancer. And the risk is a little bit higher in that setting. I think there's still more to learn here, but there does seem to be a small associated risk there.
And so, is that due to like viral load? Should people be getting, a blood test to see how much HPV they've got circulating in their bloodstream, or is that not part of the equation?
Sort of not how it works. I mean, we really seem to have cleared the virus. Yeah, but this is, I mean, you're sort of suggesting, like screening tests and other things like that. And that, a lot of work has been done on that, and it just has not quite gotten to the point where we're able to offer it in an effective way to patients yet.
But it sounds like the mainstay, really, if you want to reduce your risk of developing throat cancer, is get vaccinated, don't smoke, don't drink. And if you find a painless lump in your neck, go get it checked out. Ben, this was so great. Thank you so much for being my guest here today on CHAGPAR MD. To all of you, I hope that you found this as enjoyable and as educational as I did. We will leave you, as always, all of the evidence-based links in the description box below. I hope you will like and share this. Please do subscribe and leave us a comment. If there are other topics that you want covered, please let me know. Until next time, I'm Dr. Anise CHAGPAR, wishing you all a safe and healthy week.